Hello and good evening. I'm Melisa Idris.
And I'm Sharaad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Now, only a few months ago, Indonesia seemed to have had a handle on its COVID-19 cases. But it's now in the midst of one of Asia's worst COVID-19 outbreaks and has been said to be the epicenter of the pandemic in Southeast Asia. But what's caused this most recent wave of COVID-19 cases? And how has the Indonesian government responded to it? Our first guest on the show tonight is Dr. Dicky Budiman. He's an epidemiologist at the Centre for Environmental and Population Health at Griffith University in Australia. He's also been advising the Indonesian government and other international organizations on issues of public health for more than 20 years now. It's a pleasure to welcome him to the show. Dr. Dicky, welcome to Consider This. It's good to have you here.
Hi, Melisa.
Hi. Okay, so I think I'd like to begin our conversation by asking you to perhaps assess the Indonesian government's response to the pandemic, its management of the pandemic overall in the past 18 months. I'm just wondering whether the policies have been evidence-based because, particularly in the last 2 months or so, things have taken a bit of a turn. It seemed that in May, Indonesia had gotten over the worst of the pandemic. They registering half the number of cases that we saw in February. So where would you say the situation is now in terms of public health policy? Is it because of a failure of public health policies that Indonesia finds itself in the situation it does?
Yeah, it is. Yeah, many of the strategy the government runs so far is they not only focus on health, but they mainly focus also to the economic aspect. And in health itself, many of the indicators of epidemiology that many of the scientists like me already raised and warned the government about how serious the situation was, is not well responded so far. Previously. So, because the government just used the daily case report as the base to see and to say to the public that the response is already run well. But actually, because since last year, since the early of the pandemic, the test positivity rate is always higher than 10%, always higher than 10%. Even, recently, the test positivity rate more than 20%. So it's mean even the case is decreasing, but while the test positivity rate is very high, it means the case is not provide the real situation in the community. That's the problem. So that's why, because they don't rely on the current situation, the real situation in community, then the strategy itself will not effective in dealing with the virus. So what we see now is as the result of 1 year accumulation of this situation. Then the something that making it's worsening is because the Delta variant. Then they become a bigger problem for Indonesia, especially for Java, Bali Island, and Madura. Because Melisa, if we talk about Indonesia, it's cannot we talk generally because we have a big island. So currently, the epicenter in Indonesia is in Java and Bali.
Dicky, I want to ask you about beyond the infection rates, and I understand your point. We have a problem here with test positivity as well, insufficient testing going on in Malaysia.
Yes.
But in terms of deaths, and see, Singapore had very high infection rates, but very low death numbers. What is it like in Indonesia in terms of death? Who is dying in Indonesia and why are they dying?
So this is very good question, Sharaad, because I have to say also to the public, there is a three difference of and very important indicator, because when we have, it is very, it's very common, and we expect that we will find many infection cases. So that's not surprising that let's say Singapore or Malaysia or even Australia can find many infected cases, because this is pandemic. Everyone doesn't have enough immunity for this. But the problem is when we deal with this case, then we have to do the tracing, effective tracing. Then we have to do the isolate and also quarantine prevention strategy effectively. Then this strategy can prevent more severe case, and can also prevent the death case. When we fail within this early intervention, then the situation in Indonesia show this result, because then the early intervention is not strong enough and fail to prevent the severe case, and also then fail to prevent the death case, because very low rate of the testing and also then tracing. Then how come then we have effective isolation and quarantine then? That's the problem.
Right. I liked, Dr. Dicky, how you talked about, when we look at Indonesia, we cannot look at Indonesia as a monolith, as a whole. We have to look at different parts of Indonesia. I'm just wondering, for an international audience, how should we understand the public health response coordination in Indonesia? Who is coordinating it? Is there a kind of a federal government looking at this, or is it down to the provincial governments? Who's coordinating the public health response?
So now the central government coordinating this, and the problem is there's many ad hoc committee in central government, and because I was in government before for more than 20 years, and this is the first time in my life that I saw Indonesia, when Indonesia deal with the pandemic, they not let the Ministry of Health become the leading sector. They just established the new committee to deal with this. And this is something that I criticize also since the beginning of pandemic. And of course, there's some pro and cons, and positive and negative. But as the one who deal with this system for 2 decades, I can see that the problem is it's about, because Indonesia has many archipelago. We have many districts, and the command system, it's become also an issue. And of course, we have also disparity in the health system among the region. And then of course we have the problem with the how the leader in this city respond to the pandemic. So
yeah, Dicky,
yes.
I want to ask you precisely about this, about coming into the pandemic. What were the strengths that Indonesia had? What were the weaknesses it had? And did they leverage on their strengths, and what's happened to that?
Yeah, good. This remind me, because since the early of pandemic, I already remind again that we have, as an archipelago country, we have a benefit, because it's become the natural isolation. So when we deal with this pandemic precisely from the beginning of pandemic, then we can use this benefit to minimize the people mobilization, because this is spread by the sea, and especially the small island, and then we can use this one. But the other one, the challenge is first, then we have a problem with the transportation, the distribution of the many health tools, and also the disparity in facility. And of course, then we will face a challenge that we will have a different curve in every big island, because then what we see now is the curve from the Java and Bali. Then the other and next step we will see the curve from Sumatra, then also the other big island. That's the challenge for the Indonesia government. of course, the way we handle this, it should be based on the local or the their resources, their capacity. And I still believe that the rest of island, instead of the Java, they can learn from Java about how they prepare and how they can mitigate the COVID-19.
All right. You said that you've advised the Indonesian government for many years now. I'm just wondering what advice you would like them to heed right now, given Indonesia is in the thick of things with the COVID-19 cases.
Yeah, I have 4 advice for them, and I already sent this since early of this year. First, they have to increase their testing capacity, because without that, how come we can identify the infection and how come we can identify the cluster, and then we can do effective isolation and quarantine, and of course with treatment also there, because the treatment should be there, because that when we found in community the one who vulnerable for say to have the severe condition because of COVID, then we can deal from the beginning to prevent them become severe and also need to get the health facility. The second one, vaccination. We have to accelerate our vaccination, because even now they already compared to other intervention, our vaccination is better than let's say testing capacity, but still less than 10% of our total population still, less than 10% of total population got the fully vaccinated. So still the majority is vulnerable. And the third one is restriction. The restriction, it should be start from the borders until the community. And it's not necessarily lockdown, but it can be like maybe we have now is the large social restriction, emergency large social restriction. It's okay. No need to choose the ideal restriction. But the problem is we have to do this consistently and also with the high commitment among the leader in this state. And the last one, the fourth one is visitation, because 80 to 85% of Indonesians, when they sick, they stay at home. They don't try to seek the health facility and health treatment. They stay at home. So it's mean this is the reason why the death case is increasing, and why the number of patients in hospital increasing, because we didn't find them in the early of the stage of their condition. So I strongly advise the visitation, which is the home visit program, because then we can also collaborate with the cadre, with the civil society, or to do this one, because we have the limited number of health care workers.
Dicky, there's so many questions to ask, including the safety of healthcare workers. But I want to ask you something that's related to who's dying. In Malaysia, 70% or so are people with diabetic conditions and such. Who are the vulnerable in Indonesia?
The vulnerable in Indonesia first is the elderly. The elderly, when they are still in vulnerable situation, because our vaccination still not reach the majority of this elderly population. And the second one is, of course, then the healthcare workers, because many of them it's already in very fatigue situation. It's housed because of this more than 1 year situation. And we have lack of number for healthcare workers. And then, in many sciences, we found that when you exhausted, then you will very prone to get the COVID-19, because you will become like, is not comply to the procedure. So that's the problem. And also, if we talk about in community, then even our obesity population is also quite high. The number is high, and also diabetes is also high, even among the young population. So it's mean at the whole, there's no difference with Indonesia and other countries in terms of these vulnerable people. But the problem is how to deal and protect them. That's the problem. And so far, let's say in vaccination, sometimes in beginning of the vaccination program, the government already put the good strategy. They protect the elderly, they protect the healthcare workers. But in the meantime, I mean, in the mid phase of this vaccination, and they change to become to workers, the industrial, and this is counterproductive with the vaccination. That's why
Right.
during this situation we see many high case of death because many of them still not protected.
Well, that was Dr. Dicky Budiman, an epidemiologist with Griffith University, joining us on the show. We're going to take a quick break here and consider this, but more on this issue in just a couple of minutes, so stay tuned. Hi, thanks so much for staying with Sharaad and I on Consider This. Tonight we're discussing the COVID-19 situation in Indonesia as the country continues to grapple with the surge in infections since the past few weeks. Tane Hadiyantono is an executive researcher at KRA Group Indonesia. She joins us now from Yogyakarta. Tane, thank you for joining us on the show tonight. Now, we're seeing, here in Malaysia, we're seeing a lot of news reports about Indonesia's hospitals being overwhelmed and depleting oxygen supplies, specifically in Jakarta and perhaps in other areas of the country. I'm just wondering whether this is an accurate depiction of the current situation in Indonesia. Could you help us understand what it's like and where it's most dire?
Okay, Melissa and Sharaad, thank you for having me here. And as you said earlier, yes, the current situation in Indonesia is quite dire, especially since the June and July this month. I must remind you that July has been very hard for Indonesia as we keep on recording and breaking national daily case record. Our baseline since the end of June has been over 20,000 daily cases a day, and we recently peaked at 38,000 new cases in last week on July 8th. And like you said, hospitals have been filled with COVID patients, and our bed to occupancy ratio, especially in the Java and the Bali Island, is hovering over 80%. And there are regions who are facing oxygen shortage, including Jakarta and Bandung, and my hometown city in Yogyakarta as well. And there are cases where people are lining up in the streets to refill the oxygen tank for family members who are undergoing the self-isolation at home. The records are staggering, and I can understand how people outside of Indonesia think we're in the brink of collapse, perhaps like what happened in India. But I also must remind you that in terms of number, Indonesia is still a long way from India, who I believe on May recorded around 300,000 daily cases. So in terms of number, we're quite far away, but in medical facilities, we are quite struggling, but the government keeps on trying to step up, and I believe that we are prevailing.
Tanya, all over the world we see that the response to the pandemic is deeply political. It reflects the distribution of power, it reflects the structure of governance and administration, and also political priorities. Has the management of the pandemic in Indonesia changed over the last year or so in terms of that dimension of the issue?
Okay. In terms of management, admittedly, at the beginning, it is quite clear that the government of Indonesia is grasping straws and enacting policies that are not very effective, like a very lax lockdown and restrictions that didn't properly shut down cross-province travels, and policies that like factories and office continues to operate. And like you said as well, there are some conflicts of interest between the central government and also the local government, where a figurehead, our president says that we need to stay at home and enacted a very disciplined health protocols. However, the regional governments or local leaders are known to be quite bullheaded, where they keep letting people to have marriage ceremonies or cultural events. And admittedly, this is very, very hard for Indonesia to face because we are a very big country with over 270 million people. Thus, enacting a very strict restrictions have been very hard for us.
Right. And on that note of restrictions, I'm just wondering, okay, so perhaps compliance with restrictions hasn't been across the board, but what has that done to, say, livelihoods and the economy? I'm just wondering how the restrictions have been implemented across Indonesia, in the different regions of Indonesia, and whether that's been supplemented by financial aid by either the central government or provincial governments.
Okay, so the current restriction that we have is enacted in Java and Bali and around 15 cities and municipalities. So what the restriction is telling us to do is stay at home and stop every cross-border travels. And in terms of financial aid, the government responses by providing social aid services. I believe.
Is it enough though, Tane? I mean, the kind of financial aid that the government is giving, is it enough to keep Indonesians afloat during this time?
It's quite hard to say if it's enough or not because once again, the numbers of people in Indonesia is very big, around 270 million. And the budget that the government is preparing is around 8.72 billion US dollars. And those budget is going to be intended for cash transfers and electricity discounts and food aid programs for 10 million families, if I'm not mistaken. And this is only a small figure of the budget that should be and could be used for the people. But I believe that that is what the government can do at the moment. And at the same time, this kind of efforts is also met by the people who are providing like community-based services or programs that are trying to reach out and give aid to other people. So what I'm trying to say is that while the government are working their best, the people should also step up and do what they can do to alleviate the pressure.
Tane, is there a discussion around vaccines and vaccine choice? I know there's a global supply issue, but what has been the Indonesian strategy with regard to vaccines?
Okay, so in regard of vaccination, Indonesia is quite lucky when we quite fast in securing a contract with the Sinovac providers, the BioCansino, and now we also have deals with the United Arab Emirates where they send us millions of Sinovac vaccines, and also we recently received around 3 million Moderna vaccines from the United States. So in terms of vaccine supply, we have strong allies from other countries. And we also have the Sinovac working with our state-owned medicine company, the Biopharma and Kimia Pharma, to produce the Sinovac vaccine itself. So we are working, the government is working very closely to produce more and more vaccines. But I agree that there are some concerns in convincing the people to go to vaccinate because there are naysayers who say that AstraZeneca could cause blood clots or like the Sinovac vaccine turns out to be not that effective. But the main issues or the main discourse is that everyone must get vaccinated to achieve the herd immunity. And I suppose this is the kind of discourse that the government is truly pushing because that's the only way, I suppose.
Right. That was Tane Hadiyantono of KRA Group Indonesia joining us on the show tonight. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching the show and good night.